Good afternoon, everyone. We welcome you to today's forum session on moving from anxiety to well-being. This is part of our 2020 to 2021 virtual McLean County Behavioral Health Community Forum. I'm Tricia Millett. I'm the county's Behavioral Health Coordinating Council Supervisor. Today's presentation is by Megan Moser from McLean County Center for Human Services. And our question moderator is one of my folks, Kevin McCall, also with county. For those of you who have attended past forum sessions or the in-person event that we have had in past years, you are aware that this session is normally a big in-person event with a number of sessions offered throughout a one-day venue. With that, and in light of COVID-19, we worked to create a format that we think is beneficial for everyone. We have tried really hard to schedule things at times where we can try to get as many people as possible to attend and capture the reality that some people do better or have time in the morning versus late afternoon or over a lunch hour. So all of our sessions are virtual for the time being and scheduled through the end of April. And we hope that if this is your first one, that you will join us for others. And if this is your fourth or fifth, or I actually have lost count of how many we've done so far, that you continue to join us for more, because we have a lot of really great topics planned and have really found a lot of positives that have come out of what was initially a challenge. The forum as a whole started as one of the goals out of the Mental Health Action Plan, which was enacted by the county board back in 2015 to help educate the community on mental health topics, provide them with resources and let them know what was available, as well as to help reduce the stigma surrounding behavioral health. So we continue to do that just in a new way and look forward to the point when we can all be in person again. Megan Moser has over 16 years of experience in the behavioral health field, with her focus being on youth and now crisis intervention services. Her experience includes working with youth in residential treatment and an outreach program, as well as working with adults in case management and therapy. A focus in her treatment has always been resilience and assisting individuals in finding their potential and dealing with the stresses in life. She currently provides crisis intervention management for McLean County through McLean County Center for Human Services. She provides guidance and training for her full-time staff, as well as interns each semester, about behavioral health services and shares her passion for the field. Megan also provides presentations to the community about several topics, including suicide prevention, mental wellness and self-care, along with other endeavors, including being a mental health first aid trainer for 6 years. Megan has a passion to work in the mental health field and enjoys being an advocate for those who experience mental health crisis or issues. Megan enjoys being a role model for using self-care. I just heard myself echo, sorry. And overall wellness in her daily life, and enjoys many things to help her to keep up with the fast pace of her career. One last quick memo for all of you attending before we hand it over to Megan is that if you have questions throughout, to please use the questions box and to provide context for your question. Questions will be taken at the end of Megan's presentation, and so that context is really helpful as what does that mean or how can I improve on that will have lost its meaning by the end. So please provide context and use the questions feature, and we will ask them of Megan when we're done. And with that, I will hand it over to Megan now.
Okay, let me share my screen. Okay. Are you guys good seeing the PowerPoint? Is it just the PowerPoint? Hopefully. No? Okay. Okay. So thank you so much. I really enjoy sharing about these type of presentations. And so I'm hoping that this will give some background information and some different things to be able to help. Let's see. Okay. So in talking about moving from anxiety to wellness, one of the things I'd like to kind of start with is explain a little bit more about wellness in general and why it's important. some different things that I think are good reminders for everyone is that mental health issues are very common. I'm going to reference a few statistics from this past year because it really has kind of shown some of the things that have been a struggle due to the pandemic. But I wanted this to also kind of be universal for just in general, so I didn't want to make it all about some of the struggles that happened within this last year that we currently still, are kind of seeing. But mental health issues are really common. The common statistic right now is 1 in 5. So 1 in 5 individuals struggle with some type of mental health issue at any given time. And right now, if you were to look at just last year's information, especially some information that came out around August, September, it's really moved towards more like 1 in 4 individuals may struggle with some type of mental health issue. And so we are seeing that as a continued increase throughout the years. So definitely the pandemic played a role in it, but we've also seen more and more individuals struggling or feeling like they have had, something come up that has affected their mental health. The other thing that oftentimes happens and why we want to get information out there is because mental health issues can often develop in adolescence. So the better off we are getting some really good information to our young people, the more likely that they'll have more resilience, which we're going to talk about in a little bit, when they experience adverse situations. And so it's really important to focus on wellness so that we can kind of help when some of those issues kind of get started. The other thing that I think is important is to kind of highlight the stigma that is still surrounding mental health. I think in this past year, there was a lot of talk about mental health and how important it was. And I think that people started really seeing how important it was. So I hope that that really has helped decrease a lot more of the stigma. But at times there have been still struggles with getting people to see that mental health, getting help for mental health is not necessarily meaning that you are a failure or you're not doing something good enough, but that it is you actually taking control of your wellness. And so I think it's important to still see that while that stigma is still there, it does still keep people from getting treatment. In fact, if you look at some of the statistics surrounding treatment, right now less than half of individuals that do struggle with mental health issues get treatment. And even from the most current information out there, right now they're still saying it's closer to about 40%. You'll see it on another slide specific for anxiety, but 40% of individuals do seek help, whereas 60% do not. So we still are seeing that there are some things that get in the way of wanting to seek out that treatment, and part of that is stigma. Also, a lot of times we're not always as well informed as we could be. And that's because if you think about it, where do we get most of our information these days? Even if you were to look at kind of when the pandemic was happening and different things, social media was a big, proponent of where people found out their information. Sometimes it's just Google searches on the internet versus actually really looking at maybe the correct types of information. I always say too, for young people, where are they sometimes hearing their information from? You're looking at a lot of online things because the internet never lies to you at all, and then sometimes their peers, and maybe their peers aren't always the people that would be giving the best information. And even as adults, I would say there are some times where we don't always get the accurate information even from our friends or family members at times when it comes to mental health. So we don't always get that good information that we might need in order to really take control of maybe some issues that we might be having and really focus more on our wellness. And then the last one is, sooner somebody may get some assistance, the more likely the person would have a positive outcome. So more likely, you're able to find different things that might work for you, and that would help, as time goes on. So it really is important for everyone to be able to focus a little bit more on their mental wellness. Kind of, I tell people the same as what you would focus on with your physical wellness. So the different steps you take to keep in check some things physically, your mental wellness is just as important. So if we focus a little bit more on statistics more for anxiety specifically, which is what we're here to talk about, I know 18% may not seem like a high number when you're looking at the prevalence rate of people in the United States. However, if you think about that being very, very high when you're thinking of the 1 in 4 people that would struggle with mental health issue, it's one of the higher disorders that people struggle with. And I kind of explain that anxiety and depression have a lot of the same types of symptoms, and both of those disorders are your most common disorders when it comes to the United States and across the world. And those, I think, make sense because of the fact that sometimes you're far more likely to maybe go to your doctor and ask some questions and different things in order to see if you do have enough to meet an anxiety disorder diagnosis. So while that number may seem a little bit low, that's also people that have a diagnosed diagnosed anxiety disorder. So maybe some people that struggle with anxiety, that number might be even higher. And same thing with the 8% of children and teenagers. Most children and teenagers are developing symptoms before age 21. In fact, when I do mental health first aid trainings, we always tell people the median age of when the onset for anxiety is the lowest for anxiety symptoms than any other disorder. So the median being half diagnosed before and half diagnosed after. It's definitely much younger. And part of that being you start to see anxiety really affect your school age children. So sometimes if it's the anxiety before taking tests or going to school or things, that's when you kind of start seeing if it's maybe getting to the point of becoming more of a disorder. So that's why it makes sense that it would be a very younger age that people may have that diagnosis. As you can see, I kind of alluded to it in the previous slide, but a third of those who may struggle with an anxiety disorder receive treatment. So for anxiety, that's right in line with the general amount of treatment that's received for any mental health disorder. So again, kind of going back to what's maybe some of the reasons that people aren't seeking out treatment, and part of that could be stigma, part of it could be availability, maybe not knowing what's available. And so it's really good with presentations like this so we can show the many different types of treatment and things that people can get that helps with mental health issues like anxiety. And then the last one here I think is kind of shows worldwide as well, so that when you look at the overall worldwide amount of people that might struggle with some type of mental disorder, as you can see, specific phobia being one of the most common, which it's actually specific phobia is the most common anxiety disorder, but the least commonly treated. And the reason for that is in some cases, or most cases, if you have a specific phobia, you might be able to just not be around whatever it is that may cause that phobia. And so you don't necessarily need to get treatment for it. But also being common, as you can kind of see, is social phobias, and then also depressive disorders, which I said anxiety and depression actually have multiple symptoms that are the same. So this kind of just tells you how prevalent anxiety is and kind of what we're looking at when it comes to kind of just overall who may struggle with anxiety. So what are the symptoms for anxiety? Oftentimes it can be feeling nervous, irritable, or on edge more often than having a sense of panic, doom, excessive worry about things that are coming, having also some physical symptoms. So if you look at some of these physical symptoms, having increased heart rate, having difficulty breathing at times, could be hyperventilating, sweating, trembling, feeling tired, easily fatigued, difficulty concentrating is very common, and then some trouble sleeping and some other medical issues, which we'll get to in a little bit. But a lot of times when you'll know that you're struggling a little bit more with anxiety is when you start to feel some of those physical symptoms. I tell people a lot, oftentimes you may have some of the feeling nervous or feeling worried, but you kind of think that it's kind of normal. And then when you start to feel those physical symptoms, that's when people start to wonder if it's starting to get to the point where it may be more of an issue than you thought. I always tell people too, oftentimes you can try to kind of hide your anxiety, or you can try to, it's the same thing when you feel like stress or feel an increase in worry, it kind of builds up and builds up. And if you don't do anything about it, eventually your body has to get rid of it somehow. And that's kind of the interesting thing about us as people is our defense mechanism is that your feelings start to come out physically, which is good and a bad thing. Good thing because it's trying to keep you safe and trying to help you, but at the same time, the more that you feel on edge, the more you feel anxious. As you can see on here, if you feel like there's possible danger and you go into that fight or flight mode and you stay there too often, that's when you start having more and more physical symptoms like headaches, like difficulty sleeping. You can have, and I'll get to it in the next slide, but multiple different physical symptoms, and you wonder why you're having some of those. And at times it can be because those things have built up, and then your body's defense is that it's got to come out somehow. So that's where you get those maybe more rapid breathing or increased heart rates. So it was given to us for a reason, to try to help with that fight or flight, but we weren't meant to stay there and be in that level of anxiety for as long as we have been. To kind of key that into the pandemic a little bit, that's why several people maybe at the beginning, there was this sense of not knowing what was going to happen and uneasiness and worry, and we had to kind of adjust to that. And then as that kept going and going, we started seeing more and more people getting to the point where they were having more physical symptoms or having maybe an increase in panic attacks or things like that, because it was that prolonged experience of feeling on edge for such a long period of time that it was going to come out somehow. So we really did see that as last year kind of moved on, and even as we move into some of this year. So it really is important to see that your mental health, your mental symptoms of that excess fear, worry, things like that can come out physically and do come out physically. So what are some risk factors before I get into specifically different things for anxiety? There's some kind of common risk factors that we see, which I think the very first one, so trauma, in here says especially in childhood traumas or witnessing traumatic events can really increase somebody's risk for developing an anxiety disorder. And even in what we saw even last year with the pandemic, that was kind of a trauma that we all went through, having a lot of adjustments, or there might have been some grief that went along with it, or different things that happened. And so it really was kind of a experienced trauma by so many different people. So whenever you have that, it does increase your risk for developing some type of mental health issue, and specifically anxiety. Stress due to an illness, or really stress in general, you kind of see that stress buildup. Stressful situations put you more on edge. The more you're on edge, or what we call kind of escalated, the more your heart rate goes up, the more you're get into that fight or flight. And at that point, that's when you start to kind of be more at risk for maybe developing some of those symptoms of anxiety more of the time. Other things that could kind of put you at risk would be personality. Sometimes people's personality types just tend to be more worrisome than others, kind of get more stressed than others, and it's just, kind of their nature. Sometimes if somebody may be diagnosed with a different mental health disorder, anxiety also goes along with it. So it's fairly common that somebody may actually meet the criteria for two different disorders, because of the fact that maybe they have that excess worry and different things, and maybe they also have other symptoms of other disorders, whether that be mental health or substance abuse as well. So whenever you have a different disorder, it would put you more at risk maybe to have some symptoms of anxiety that goes along with it. Having blood relatives, there is heredity that goes along with mental health issues. So if your parents or your grandparents kind of struggle with it, you may be more likely to kind of have some of a risk towards struggling with an anxiety disorder. And then sometimes with drug or alcohol use, a lot of times it's whenever maybe there's a withdrawal, or if you're using more than you normally would. Some people don't realize that maybe in the moment it will help your anxiety, which we're going to actually talk about a little bit later when we talk about wellness. I'll kind of explain why. But it kind of does change some of the chemical makeup in your brain, and it makes you feel better in the moment. But unfortunately, long term, it doesn't make you feel better when you either go through withdrawal or when you're not using that substance. So it actually doesn't help, and it puts you more at risk towards having an increase in anxiety if that's what you're using. Another thing that I like to keep in mind for some people is that anxiety does come along with multiple different medical issues. And this isn't even all the different medical issues that it could be, but this is kind of some of the more common ones. So if you kind of look at this list, if you have heart disease, diabetes, COPD or asthma, sometimes withdraw from drugs or alcohol, chronic pain or IBS, each one of these different things, actually part of some of the symptoms that can come along with it is anxiety. And part of the reason for that is because of some of the medications you can be on. some people don't realize that you might be taking your medications as prescribed for your medical issues, but in the end, it may cause some symptoms of anxiety because that's a side effect of your medications for it. And so, I try to remind people that sometimes you didn't really necessarily have issues with anxiety before, but because of some medical issues, now you sort of struggle with more of those type of symptoms as well. And so it's really important to find ways to kind of help with that, especially if you do have some of these medical issues. So when we're looking at anxiety, the most common question I get asked, at least, is when is it just I'm more anxious, or I'm just going through a period of time when I'm more worried, and when is it getting to the point where it's more of a disorder? And so, this kind of is a kind of thing to show you a little bit, and I know there's a lot on these slides. I tried to put a lot of information in for whenever people would see these after the fact, so that you could have all this information. But essentially, everyday worry, and this was really common, including, last year, with different things being much more of a cause of worry. I tell people, for example, with my staff, I worry about my staff all the time and their health and things. But when the pandemic happened, I had this constant, worry every day for their health and if they were going to be okay and different things, just because of everything that went along with the pandemic. So I had to kind of adjust to the fact that I might have had this certain level of anxiety before, and then now I was having a different level and I would have to do something about it. So with everyday anxiety, definitely having some worry about normal day-to-day things that you need to do, or maybe different things that happen in your life. So trying to get a job, maybe there's an important event coming up, or you maybe had a breakup or something. Those are very common and can cause increase in anxiety if you had different types of social situations that weren't, maybe didn't end up the way you wanted them to, which really increased your self-consciousness or different things like that. That would make sense that you might have some either physical feelings of anxiety surrounding that, or kind of maybe think about that more often or things like that. Maybe having a presentation, or maybe having kind of a test coming up, any type of realistic fear, about things. So maybe you are in a situation where it really could be that there's something dangerous that's there in front of you. Again, remember that fight or flight I talked about earlier. Your body's natural tendency is to jump into that fight or flight mode when there is maybe something that's dangerous. It may not be as dangerous as we're feeling it is, but still, if it's something that would provoke that, then that could be, normal amount of anxiety. And then maybe having some different things that might come up after traumatic events. So, similar to what I was saying during the pandemic this last year, and even how you might be feeling now, it would make sense that there might be some difficulty with sleeping, or having some increase in symptoms. When it's starting to get to the point of more of a disorder, the thing that I usually tell people is you really want to pay attention to if it's causing a significant amount of disturbance in your daily life. So kind of, and this comes from mental health first aid a little bit, but if it gets into your ability to either like work or go to school, your relationships with other people, so if it's starting to get and impact your relationships, or what you do on a daily basis, so cleaning your house, wanting to get up and take showers, or maybe getting to the point where maybe you're avoiding, certain things that you normally would do on a daily basis because of the symptoms of anxiety. That's where it's really getting into more of a issue of maybe wanting to get some treatment for it. Back when I was talking about social phobia, specific phobia being one of the most common anxiety disorders, a good example of maybe something that you maybe wouldn't need to necessarily seek treatment for is maybe like if you had a fear of, let's say, maybe spiders or snakes. I know for me, I don't like snakes. Maybe you just avoid being in areas that have that, versus if you had, let's say, a phobia of needles, and maybe you have diabetes and you need to take insulin, then that would really kind of impact your daily life, because you would have to find ways to be able to help you so that you could still get the type of treatment that you would need. So it just really goes back to, is it having a significant amount of distress in the things that you normally do day to day? If you're having kind of out of the blue symptoms, So we'll kind of talk a little bit about panic attacks because that's one of the common things that can happen when you have an increase in anxiety. And sometimes that kind of shows a lot of physical symptoms that will come out from anxiety. If you're having them out of the blue and very, very often, or you're being very preoccupied, different kinds of fears, those would get to the point where you probably are moving more towards an anxiety disorder, or starting to have more irrational fears, or really avoiding different things that may not be as dangerous as you're thinking, or there really isn't as much of a threat, but you think there is one. And definitely if there's some reoccurring nightmares or things, or if you have had a traumatic event and you keep experiencing that over and over again in flashbacks, that's when you're really moving more towards maybe a disorder. There usually is a certain amount of time too, which we'll have on a different slide, but this kind of gives you kind of something to look at to see where's the difference between the two. So going into the panic attacks and what some of those symptoms are, this is really very similar to like a heart attack. That's very, very common. I know sometimes when we have people that we may see in the emergency rooms or things, they may have really believed that they were having a heart attack, and sometimes they'll end up seeing us and they kind of wonder, why do I have to see somebody for mental health? And we'll kind of explain that oftentimes it feels exactly the same, that you have kind of that rapid heart rate, sweating. I've had people anywhere from chills to hot flashes, nausea to just being dizzy or lightheaded. Kind of you can see on the slide kind of all the different things that you can feel, and sometimes people feel different ones. And so it can be difficult to tell the difference. So sometimes the first couple times you may not know, and we always tell people to err on the side of caution, definitely, if you're not sure. But eventually, if you start to see that this could be just signs of more of panic attack symptoms, then there's things you can do to try to help with them, which I'll get to a little bit later in the presentation. But these are kind of the more common symptoms when you're really having more of that anxiety attack or panic attack. So kind of going back into that line of when should you seek help, or when should you maybe try to start doing things to assist with some of the symptoms that you're having. So the key warning signs really that you want to look for is, going back to like I said before, is it impacting your daily functioning? If it's really getting in the way of you being able to complete the things you want to do, you might want to reach out and just see what's available. Also, if you really have, and this is something a lot of people started noticing even last year with the pandemic, having more irritability, not being able to concentrate on things like you normally would, not enjoying the things you used to before, just those bigger changes, that's when you really would probably want to say, okay, maybe I would want to see some more information, about this. If your eating or sleeping has changed, that can be really big, because then that can kind of show that it really is, again, going back to kind of changing your daily life. And the interesting thing is there are many, many different levels to maybe what kind of help that you can get. And on this slide, you can kind of see, because I got this from one of the main CDC websites, but even talking about even going just to your primary care doctor and asking a few questions might open up so many different options for what you could do. And there's many different levels to what help actually would look like based on kind of what your symptoms are. I kind of really like this. I hope this is big enough and you guys can see it. It came from the National Institute of Mental Health, and I kind of thought it was a nice little infographic to kind of say, hey, when is it starting to interfere with daily life? So kind of looking at kind of a 2-week period, have you been kind of having some of the symptoms that it has there, feeling down, not able to do, going back to your daily activities or work, trouble sleeping? If so, here's kind of the first line of what you could try to do. So some self-care, which we're going to totally get to in just a second for moving to kind of well-being, but maybe some self-care things that you can do to help. But if it's not really helping, maybe contacting your healthcare provider, asking some more things, and then kind of moving into, do I think I might have more severe symptoms? So that more difficulty sleeping, that difference in appetite, maybe struggling to deal with your moods, whether that's getting out of bed or that irritability, that difficulty concentrating I talked about earlier. That's really kind of showing that maybe it's getting to the point where if you are having these more severe symptoms, maybe talking to somebody else would be good. And then kind of that last box of what does it really look like when you're seeking professional help for that? And there's so many different options, which we'll talk about in a little bit, but even there, it kind of shows there's some different kinds of therapy you could go to, medications, different things like that. And then we're going to talk about some apps and some self-care strategies that really can help too on your level of trying to figure out what do I think will be helpful and what should I really seek as ways to deal with some of the symptoms that I'm having. The other thing that I have on the slide that I thought is really good is the CDC actually really, I think, upped their game when it came to having a lot of mental health information on their website. I know they even had so many direct links with with COVID and everything to many different areas of mental health. So it actually, we would give out those as resources so often because it even had, things that you could say to your kids and things to look out for. So that was a really, really great resource. And then you can see this infographic came from the National Institute of Mental Health. They've got some great resources as well as NAMI as well. So I kind of just said there's so many different websites that can really give you the correct information, going back to making sure you're not just maybe looking up or Googling just any kind of information, but really looking to institutes that can give you the correct information. So those were really good. And so this was the one slide that I did add in for the pandemic last year, because there was quite often that I was asked to do some presentations about just the increase in anxiety and stress that was all during the pandemic. And as you could see from some of the studies that I quote, a lot of the isolation, the having to be physically distanced, it really increased the amount that people struggled with mental health issues as well as suicide. And then having so many different things happening at once and different types of crisis happening, it became very, very difficult. Going back to those statistics that I had, so before, most people remember it was like 18% may struggle with an anxiety disorder. When they did more studies during the pandemic, so this was in August, it actually had gone up to, for people that had at least one adverse mental health experience or mental health issue, it went up to almost 40%. So from 18 to 40 was really a very large increase. So it kind of just shows how much that really was a struggle for a lot of people. And I kind of just gave a couple of examples of why that really happened. And so I think, as you can imagine, the uncertainty was really, really difficult, what was within our control versus what was not within our control, and kind of really increased our anxiety and worry because we didn't have, all the answers. And then we were told so many different types of information. The isolation is huge. We're going to talk about in just a second when I get to well-being. The connection is one of the most meaningful things that we can have, and one of the things that we need. So the more that we were isolated from other people and didn't have that connection, even though we had virtual things, which I'll get to in a second, it wasn't the same, as having kind of that in-person connection. So it really was very difficult, and it happened very quickly for some people. The other thing, so kind of going into some of the virtual things, was we kind of switched to a lot of virtual meetings or virtual get-togethers, with your family. And there's actually some really interesting, I never thought I'd get into brain things as much as I have in the last few years, but there was a lot of information that came out that our brains actually had trouble being able to process virtual meetings, because when you talk to somebody face to face, you can see so many more of the nonverbal things and kind of how people may say things or how they're acting or things like that. And even if you're talking on the phone, we're so used to talking on the phone and kind of listening to the inflections in somebody's voice or things. But whenever we'd have the virtual meetings, because of sometimes either not being able to hear totally what somebody's saying, or them to hear you, or talking at the same time, or different things like that, your brain wouldn't process it the same. So it's actually really interesting. So it wouldn't give some of the same satisfaction or benefit as some things that had happened previous, because it was on a virtual basis. But the other thing that would happen at times is people would really struggle with paying attention, because it was just such a different format, and it was very difficult to, you may be seeing this if you have kids with virtual school and different things. Different people are able to do things in different ways, and some really excelled at the virtual learning versus some really had difficulty with it. The other thing when it comes to like non-inclusive language is what would happen is sometimes on a virtual setting, whenever somebody might throw out just a question that you would think that anybody would be able to answer, sometimes people, because of the pandemic, you wouldn't always know what was going on in somebody else's life. And so if you were to say something like, maybe trying to motivate your team or just talking to your family, like, hey, what's the best things that happened this week? And maybe, one person in the group, it was really, they didn't have anything, really good happen. And so it kind of made people feel not included because you were trying to make a statement that was kind of trying to help and get people thinking more positively, but maybe at that point in time, that wasn't something that they really felt like they were able to do. So it became kind of non-inclusive. And then unconscious bias is sometimes as we started getting into people's households or things, sometimes people, would turn off their cameras at times, and people would make assumptions on why that is, or maybe there was some stuff in the background or different things that all of a sudden you started, having almost like a lack of privacy at times, or trying to figure out what do you put everything. So it was kind of this huge switch that happened when we went to virtual meetings. And then just the overall emotional fatigue really added to the anxiety. So feeling overwhelmed for longer periods of time. So kind of going back to the idea of being in fight or flight for so long, it just really takes a toll after a while. And then feeling overstimulated with information, which I'm sure we all had at different times. That grief, maybe I know even for myself and my family, we had a family member pass away, and we were not able to be as involved as we would want to be because of COVID. So we didn't get to see them and things. And so it was a really different way to process what was going on, and kind of that different level of grief that you might have. And then just trying to make sense of an overall senseless situation, something that we can't control, and trying to understand why, it's going on. So all of these changes really added to why we had that increase in anxiety and worry and different things. And you're seeing it in kind of the mental health issues from this past year. So what do we do about that, knowing that it's been a difficult year and things, and we're still not, totally out of it yet? But it's really this idea of resilience. And so as I get into more of the well-being information, it's really working on a resilience. And the thing that I want you to take away, because this is a lot of information on a slide, but the main thing is the kind of the bottom one. Resilience isn't just something you have or don't have. It's like a muscle. I tell people, if you work it out, if you try things, if you have to live through things, I can't remember how many times I said over last year, if we can reframe or find ways to learn or find the opportunities in the, sometimes horrible things that happened over, the past year, the more that you're flexing that resilience muscle, the more you're showing that you've gotten through something and how strong you are. And so that idea of resilience is really adapting well in the face of adversity, trauma, any type of significant stress. It can be from anything. It could be from workplace stress to school stress to financial stress, just any difficult experiences, that ability to bounce back, to be able to learn something from it, and then, take that learning and move on with that, and maybe use that to your advantage. That really, really helps. And the person, it doesn't mean necessarily the person doesn't, like, if you're resilient, it doesn't mean that the person doesn't experience difficult things. So I had some individuals were like, if, for example, you were taking the pandemic, really well, and some people say, well, how come you're taking this different? Why aren't you more stressed? Why aren't you more worried? It wasn't that they weren't worried. They were just dealing with their worry in a different way. So resilient doesn't mean you just don't, ever have stress and don't ever have worry. It just means that you're able to kind of take that and then try to figure out what you can do with that. So that's really what we're kind of working on. The other idea of it, and it's kind of the first one up there, is it doesn't happen in a vacuum. So it's constantly moving. I told people this past year, I learned even more about self-care than I ever thought I could, just based on some small things. And I'll get to it when we're talking more about the wellness things. I mean, on a daily basis. So I'm on call 365 days a year and have a job that's usually a little bit more stressful than most. And I really live by all of the things that I'm going to tell you guys about, because it's the only way that I'm able to continue to try to deal with, all the things that I have going on. And so really building up that resilience, it really doesn't happen in a vacuum. You really have to kind of figure out and manage as things really come at you, because it seems like we're always kind of having more and more things, thrown at us. So what would it be for wellness? Kind of moving into what do we do if we're having kind of these issues or struggling with some of this. So the biggest one, like I said earlier, is that connection and support. And so there's so many studies that show that when you have a support network, whatever that support network is made up of, so whether that is professionals, whether that is your family members, whether that is your friends, anyone that you consider to be support helps with resiliency as well as burnout in general. Also having good relationships with different types of people who are there to support you helps with your resilience. The other thing is being maybe active in different types of groups or having kind of that community support, that social support really can help many different people. I also remind people that sometimes it's really good to have different types of supports. So maybe sometimes people that are in your same field that you can kind of talk about the struggles and vent and different things, but then also having individuals who maybe don't work in that same field or have the same beliefs as you or different things like that. It can give you a different perspective and it can kind of help with having even a more robust amount of support. So it's kind of important to have different types of support in different experiences. So when we talk about wellness, it's kind of broken up into different areas. And the main ones that I kind of talk about is, so wellness includes many different parts of your life. This little wheel that's there, I think is kind of the best way to explain that there is different aspects to what would help with your overall wellness. When we go into what helps your wellness, that's when we get into self-care and coping skills. So self-care is making sure that you are focusing on what will be able to assist when you might be struggling with different types of symptoms, which includes, different types of mental health symptoms. Really making sure you're taking a look at what is getting maybe in the way of you focusing on your self-care. I hear a lot, of guilt. Like, if you maybe had a physical, illness or like, let's say maybe you broke your leg or things, people seem pretty understanding of, hey, I'm not able to do some of the things that I normally would have done before. But when it comes to more mental health issues, because people may not be able to see that or they may not know about it, when you want to take some time for yourself because you've just been feeling more anxious lately or you've had more worry, people don't see that the same. They don't see it as a reason, to necessarily focus on their self-care. And so people put it off. And that's where I do see a lot more often where people will put it off until they're having those physical symptoms. And then they wonder, why are they feeling this amount? And sometimes it's because you've let that go on for, a certain amount of time. And so in looking at, what maybe had a role to play in that could be the guilt of not wanting to take the time out to do it or feeling that you needed it. Also, what I find is people don't always know what the resources are available. There are so many free resources now with different things on the internet and apps, and I'll totally explain some of those in just a little bit, but there's so many different things in books and things that you can read that can really help. And then you have different options when it does come to professional help as well. And then things that help to increase your amount of self-care is your coping skills. So coping skills are kind of that mixture of different types of things that you do that will be able to help. So it kind of goes into each one of these areas of wellness, but there's different ideas of different skills that you can have. I always really encourage that you try new ones all the time because you never know when you may not have access to one. So I know for myself, I can give an example. I am so, something that's so important to me is I get massages on a regular basis. I find it to be very, very important for my self-care. And when the pandemic hit, everything closed down. And so I had gotten so used to having this routine and it was completely taken away. And so I had to find other things that I could do to give me that same feeling and be able to help with my self-care. And it took me a little bit to kind of figure that out. Another one that was an example, which happened, and I actually didn't realize this until more recently when I tried a new self-care technique, which I'll tell you all about, is my dog passed away 2 years ago, actually. And we had felt, that there was a change and things, but it wasn't until the pandemic that I realized I really had gotten accustomed to him being around and different things that happened, and I hadn't found a new coping skill that was filling that void, for me. And so I had to kind of change that. So, really trying to find new ones and trying to make sure you have a vast array of them can be very, very important because you're never going to know when you might actually need that. The other point that I make on here is maybe try things that you've never tried before. So I guess I could say that now. Each year, I know with my staff, we really focus on self-care and we always encourage everyone to try things that they never tried before. So my example that I always tell people, and this is probably now from, I guess, 3-4 years ago, is I was told to try adult coloring as a coping skill, which I don't believe in as a coping skill. I find it to be very anxiety provoking for me, and I hate it actually, but I tried it and I did give it a shot and I decided that's probably not for me as much. But one that I've tried more recently, actually this year, which I have tried previously and never really liked, is kind of getting into some of the meditation apps, the soundscapes and stuff. I had never really gotten into it, didn't like it, but then for whatever reason this year it just clicked and it's been really helpful. And so it's just interesting that sometimes you might want to go back to trying things that you may have tried in the past, or you may have thought, oh, I don't like doing that. Writing is another one. I think I see people that, for a lot of their life, they maybe hated writing in a journal or something. And then when they actually started doing it, they really liked it, or maybe reading certain kinds of books. But just trying things maybe that you thought you didn't like, you might be surprised at what might be helpful. So really working on making it a routine. So some things that I find that people kind of put off and don't make it into a routine. If it's not a routine, it won't be as helpful for you when you really, really need it. So I really encourage trying to make it a routine, even when you don't think you necessarily need the self-care as much. And so ways to be able to do that is, first of all, really taking the time out to make sure you're caring for your basic needs, which is, there's lots of reasons why that's really important, but it's really helpful when you make sure you're taking time to drink a lot of water during the day. Make sure that you have, take time out to eat. I find that people sometimes get so, and I do this a lot, get so busy, or they do a bunch of things and then they put off doing stuff, and then they find that they're not working maybe to the best of their ability because maybe their blood sugar is really low, or something like that. And then, other ones on here that you probably have been told before are really good is, exercise, being able to make sure you're getting enough sleep, hygiene, and then that mental health support. I'll talk about kind of those coping skills that even help with your mental health, not just your physical health, are really, really important. One thing that can help is making sure that you put into those daily routines things that will trigger you. So for example, on your phone, you could set reminders. Some people go by time triggers. So like on every half an hour of the day, that you have a thing that reminds you to do, some type of self-care, whether that's maybe drink a glass of water or do whatever. But kind of having those triggering things. I know for some people, they even put maybe like Post-its somewhere where you're going to go by that place at certain times. So any of those things will really help you make it more automatic, making kind of that commitment, kind of saying, yes, I really want to take care of my self-care, and saying I'm going to make it a priority, kind of helps some of the guilt that you might feel, knowing that you're doing this because you want to be at your best and you want to make sure that you are helping with how you might be feeling and maybe some symptoms you might be having. Making sure you keep practicing it. Keep trying to find ways until it becomes like you just kind of have it as a part of the things that you do on a normal basis. That can really kind of help make that routine. And then making sure you have some different tools. I was just telling people, I don't know if this was the difference in my meditation game or not, but I had always had my phone next to me with the app going, and instead I bought a pair of headphones on sale from one of those Christmas sales, and put the headphones on, and it's like a whole different game changer for me. It was just a tool that made it a completely different experience, and it's really, really been helpful. So sometimes finding the different supplies, or even if it's just, having a certain type of scent, we'll talk about that a little bit, that kind of helps. Having those handy is really, really nice to make it more of a routine, and then involving your kids, your friends, your family, really kind of making that more consistent, accountable, and kind of, I tell it for young people, being a role model for young people to see how you handle, your self-care as well. So this, I think, is a really nice slide because it kind of helps to explain why coping skills work and why you have to have different ones. to go along with the wheel that I'll talk about in just a second. So on here, I didn't come up with this, I got this, but it's a resource that came out that we found when we were looking up COVID resources. It kind of shows like if you have a different area that you're having some difficulty on, you can see kind of down below. So each one of those are different levels of chemicals in your brain that be able to help with happiness, makes you feel better, makes you feel, less stressed. And so you probably heard, multiple ones of those before, but there are different things that help trigger those. So like you can kind of see which ones kind of are helped by which coping skill on here. So for like dopamine, maybe meditating, doing a to-do list, or coming up with goals and making those goals, doing something creative, exercising. Serotonin is also, for exercise, but you also need sunlight for that, or maybe massage or things like that. Endorphins, having laughter, eating certain types of things like chocolate or spicy food is really helpful. So you can kind of see how there are different areas that affect different ways that make you feel better, which is why it just kind of adds to the idea that we really do need to be trying different things to help with our overall wellness. So going back, I figured to add kind of as we're doing wellness to be more specific for those panic attacks, because sometimes those can be really difficult. So different than more general anxiety or feeling on edge, when you're really in that moment where it is more intense, what are some different things that will be able to help? Because sometimes you might not be able to just pull out that coping skill right away to be able to do it. So some things overall that can help, because you really want to be working on symptoms of panic attacks before they even happen. That's the biggest thing. So when it says that first one, sticking to your treatment plan, maybe trying to find what works best for you so that you're not too afraid to try different things because of the fact that you might struggle with maybe being worried about if you're going to have a panic attack or not. There are a lot of different support groups that are available so that you can feel, you can get kind of information from other people that might struggle with that, or just having that support. Remember, increase in connection and support is really, really big. So being able to have that. And then kind of avoiding caffeine, alcohol, smoking, and drugs, back to what we talked about at the very beginning of this, those can really make it worse in most cases than necessarily making it better. Same thing with practicing stress management or relaxation. Those can really help for overall kind of tension relief, which the idea is to hopefully not get it to the point where you would have as many anxiety or panic attacks. And then being physically active and getting enough sleep. You've kind of seen that on multiple slides, and as much as we may not want to hear it, all the time, those really are proven to really affect those different brain chemical levels and things. And so it really does help. Same thing when we look at different other areas. So like humor, for example, it can really be helpful. We used to encourage, funny memes or cat videos or things like that would be able to help with kind of making sure that you laugh, each day, or maybe watching a funny movie or things like that. The first two, kind of understanding that you can't control everything. That locus of control is what we kind of talk about when it comes to anxiety, is really having to take a step back and realizing, what do I have control over and what do I not have control over, so that you can get perspective. I kind of said earlier, when the pandemic happened, I had this increase in worry for all of my staff and different things, and I realized what was really helpful was to try to make a list of what did I have control over, what procedures could I put in place, how could I get some PPE to them, do different things so that I knew I had done as much as I could control, and then I would have to let go of the things that I wouldn't be able to control. And so kind of putting that things in perspective. Also knowing that you've done your best, but maybe not aiming for perfection. Perfection can be really difficult. It can cause a lot of anxiety. And so knowing that maybe you might not be perfect, at everything, but that you can still be proud of where you got to. Maintaining a positive attitude really has been proven to help, especially with replacing maybe negative thoughts with positive ones. And you can see some of the other ones. Learn what maybe triggers your anxiety more. That's where that maybe journal writing helps, or really taking a step back to think about what might be triggering your anxiety. Talking to somebody, friends, family, could be professional help as well. And then maybe getting involved with different things. You can kind of see on there, it's kind of going back to what we said earlier with that connection and support. Anything that gives you more and more connections can be really, really helpful. So for that acute anxiety again, and I wonder if I should be working, I think, if you guys can see this on there. if you have certain types of apps or anything that works with maybe some breathing techniques, that can be really, really helpful. Some things to really do in the moment, focusing on something in the room, sometimes a clock, sometimes just an object really can help you center, become more grounded. Practicing some muscle relaxation or mindfulness. So again, kind of going into that calming techniques, relaxation techniques. Smell is actually a really good thing. Knowing maybe ahead of time what things really help to calm you. Maybe there's certain scents that you really like, and being able to kind of have that close by can be helpful. And then I kind of said earlier, the deep breathing. I don't know if you can see the breathing in and breathing out. There are certain apps, which I'll get to the apps in just a second, like the Calm app or Headspace or different things where they actually have breathing exercises where you can learn different techniques for breathing, and being able to kind of count and visualize, maybe counting or having something that kind of helps you visualize having and taking deeper breaths is really, really helpful. And the last one, recognizing that you may be having the panic attack and knowing that it'll be temporary. So there's things that you can do in strategies that we just talked about that would be able to help it. So sometimes knowing it will be over and then keeping that in mind can be really, really helpful. So I was kind of alluding to this multiple times, so you can kind of see. I'll just do the apps right now because I've got two other slides that you can see the wellness wheel a little bit bigger. So there is a lot of different self-care and wellness apps, and what's kind of nice is some of them have even extended the amount of time that maybe they have free options, but then they have given some free trials and things so that you can really try some of their non-free options. There's several on here I use, some on a daily basis, some on a weekly basis, and you'd be surprised how many at least have really nice benefits in there, even free for the version. So I would really recommend trying some different apps and things just to see what it's like. So going to the other one with the wellness wheel, this kind of breaks down, and it's something that we have as a handout, to you as well, so that you can take these and maybe it can help you remember that wellness is really broken up into different parts. And so these first three, so oftentimes what I find is that people are really, really good at one or two areas in their wellness, and that's what they focus on most of the time, but they forget some of the other areas. And so you wonder why maybe when you have your routine or you've done the same things, it's not helping as much as it was before. And so hopefully this can kind of show that maybe it's because you need to be working in a different area to help with the level of anxiety you're feeling or the level of stress that you're feeling. So these are just three of the options. So looking kind of at emotional wellness, and then there's some questions and things that you can think about to help you decide what would help with that. Spiritual wellness, intellectual wellness, and then the last three being relaxation, physical, and social. So like I said, kind of trying to figure out a nice mixture of multiple different things. And then remember on that previous slide, so each one of these different areas usually affects a different level in your brain, serotonin or dopamine or different things like that. So that's why we want to try multiple different things. The other thing I oftentimes remind people is if you have experienced something that's been really, really difficult, or maybe you're just going through a season in your life that has more anxiety or things, is really trying to keep in mind that whatever you were doing before, you really want to up and do more things. Because the more that you're able to combat the increase in the amount of anxiety that you feel, the more you can keep yourself a little bit more balanced and be ready for kind of the next things that come in. So like I said, I kind of practice this on a regular basis so that sometimes I even do it when I don't even need it. So I've told people, I practice my self-care when I'm not feeling like I need to do self-care, but that's because I never know when I need to kind of do different things. So I'm trying to be ready for anything that could happen. So this can really, really be helpful when you're really looking at what are the biggest, most influential things towards wellness, is really working in these different areas. So I will unshare my screen, I'm guessing now, and maybe do questions. Let's see how I do this.
Well, so we will read questions to you as they come in.
Okay.
So to our attendees, if you have questions, please feel free to put them in the questions box. So far for you, Megan, we had one comment of someone who appreciated your presentation but had to jump off at 5 and wished they had been able to stay. I want to thank you for the information you gave and think that it's extremely helpful that you not only talked about anxiety in a general sense, but also how that relates to what we all have gone through in the past year
Mm-hmm.
and have identified that whatever coping may have existed before may have needed to be changed, or even as you just talked about, that we may need to increase it or really bump up what that is. And I've heard that from so many people that they knew how to cope with their anxiety previously, and those things just aren't working anymore. And recognizing that situations in life may change what we need to do. The other thing that kind of came to mind as you were presenting is that self-care and coping and wellness is not cookie cutter. And so what works for you doesn't necessarily work for me, although I
Mm-hmm.
think we share similar sentiments on things like journaling and adult
Mm-hmm.
coloring. Um,
Oh,
but
good.
but they work beautifully for a lot of people. And so the way I focus on self-care is not the way that you do, or that Kevin does, or that any one of our attendees do. So recognizing that what someone in your life does may not be the best option for you, I think is a really good reminder for people. And
I didn't want
so,
to, I know it was interesting that for a while, I didn't want to make it solely about, the pandemic, but we had talked about even with our group, how really the pandemic was just an example of a really difficult stressor. And that, things will come up in your life and you'll just never even know that that was going to come up. And it was just one that we universally all felt at the same time, but that it really did test, one, what our routines were, but then two, it just highlighted the fact that yeah, sometimes you even have to try different things because it was going on for a very long period of time too, and
yeah.
that's why it still will. So yeah, I'm glad that I got that out of it, because I know it's something that we all kind of had to adjust, with, and still do, adjust to, because you never know what life will throw at you. It seems
Yeah.
like.
Yeah.
So it looks like
And
we did have one question come in here,
Sure.
but I actually have my own question, and it's just in the same vein of what you're talking about. So I'm gonna
Okay.
rudely jump ahead and ask mine first.
Okay.
Talking about all of the COVID stuff and anxiety and depression from maybe not being in the workplace and not being able to socialize and all those things, and because I know you kind of have your pulse on mental health trends, especially here locally. How much do you think we should anticipate that there's going to be anxiety or even depression for a return to work?
So that's a really, really good question, and we've been prepping people for that transition again. For some people, it's, without getting too far into it, there's some really interesting things about normal and what we consider to be normal, and everybody's really pushed to get back to normal, when the reality is it will never be the same normal as it was before, which is something in general we always have, but it's just a different perspective because so much changed so quickly. And so when people do get back into, kind of going back into the workplace and doing things, it'll be kind of like experiencing the first parts of the pandemic again in some ways, because you'll have an adjustment. What's it going to be like now? What are the requirements now? What are some things that are still unknown? We don't have everything totally known at this moment. And so we just got adjusted to where things are, and then now we're going to adjust things again. And that's probably been the biggest difficulty, is we found some people were able to handle the beginning, parts of the pandemic, and then some people, they took a little bit, and then the middle part, that was okay, but then, throw one more thing. And then the difficulty too is when you start adding in what may have happened during that time period. So you have sometimes this high level of adrenaline, this level of maybe stress and things that you've been dealing with, and then now it's sort of the aftermath of it, where you're trying to come back down off of it, but now you feel like you are wrong, or there's something going on that you should be more concerned about, and so you almost increase your anxiety, being worried about if you should be more anxious about where we're going. And so it's a cycle. It's one of those never ending cycles, where I think going back to that resilience piece, I really focus a lot on that, because if you practice all of those different things, you'll be ready for whatever will come. And I know I tell people all the time, it seems so, simple, or, well, I already know all that stuff. I already do that stuff. We do, but my most common answer when I ask people, like, that come in and they say they're struggling, I'll say, okay, well, when's the last time you took 2 hours to yourself and didn't have your kids around? And they'll be like, well, 5 years ago. Okay, well, that might be, a little bit, but it's true. We get so busy. We were so caught up in doing things the way we were doing it that until all of a sudden, something happens to really kind of jar you, you're just going along. And that's why it is so important that we really do this stuff and make it a routine on a daily basis. And I think that we need, in some ways, to prep for what it will be like, for kind of getting readjusted to what, I hate kind of the new normal idea, but adjusted to what it's gonna be like, in the next few months. So hopefully that helped.
Yeah, absolutely. I know as terrible as COVID and everything has been, we're certainly learning a lot about mental health. So I'm at the very least interested to see how things kind of evolve here within the year. So I'll go ahead and ask this next question now, since I'm sure they're waiting to get a response. But this question comes from Keith Stednicki, and they're asking, where are you finding the 1-4 dealing with mental health challenge? And it says mental health index, question mark.
Say the first part again. Sorry, I think.
Yeah, where are you finding the 1-4 dealing with mental health challenge?
1-4.
1 and 4. Sorry, 1 and 4.
Oh, got it.
Thank you, Keith, for clarifying that.
Oh, no problem. I was like, wait, what? So that is a study that came out in August, and it is from the CDC that came out with part of it, and then the National Institute of Mental Health. They basically did this study across different areas, and the way that they worded the question was, have you had any adverse experiences with mental health in the past year? And so that was the first time that it got up to 1 in 4 individuals that were struggling. And so I think what it was really showing is, obviously during the pandemic, people were realizing that they were struggling more with it. And I think too, with the way that that's worded, I think almost everybody probably had at least one adverse, mental health experience during that past year, I would think anyway. So I think that that's why it really moved that kind of from 1 in 5 to 1 in 4. So I'd be interested to see when they start really doing more studies on that, if that's going to continue to be that way.
Yeah. And I will add, as you were showing the slide that had the National Institute of Mental Health sort of image or like infographic, I went and found it from the site, and it has been added as a handout for folks.
Oh, nice. I really liked that one.
And so also to our attendees, Megan had included 4 handouts already that were already shared out there. And then as she showed that one, I pulled it and added it out there. So you do have 5 handouts that you can either save or print out for yourself as resources after the fact.
One of them I didn't have a chance to kind of show in the PowerPoint, but I wanted to add it because my staff actually really liked it, was the challenging anxious thoughts one. When we went through all the resources, we actually try them first before we give them out. And that seemed to be the winning one that helped the most people to really kind of take a look at what were they thinking and kind of break it down a little bit more. So I don't know if you'll like it, but that one I wanted to add because it seemed like we liked it the most.
Yeah. And I think that's good information to share, that I think some people don't always realize, is that a lot of the things that we recommend are also things that we have tried or do on a regular basis. And I know those are words that come out of my mouth, is almost anything I am suggesting to you is something that I either have done or currently do, or at least tried to be able to understand what it may be like for you.
Exactly.
So.
Yeah. I think it makes it easier to relate it to other people too, because you'd be like, hey, I tell them with apps all the time, there's some I absolutely hate because I tried them and I just don't like them at all, and then there's some that I love that I know nobody else probably would use for the same thing, but I can at least be like, hey, I love this app and here's why I like it and here's what I tried on it. I think that can be really helpful and relatable. So
All right, that looks like that's it for the questions. And even though I butchered Keith's question, he says, great, thanks. So it looks like you gave a good response.
I'm sorry.
Well, and in the interest of apps, I actually really liked that you included the Relax Melodies one, which I actually never think of in terms of self-care or relaxation, because I first found it when I was looking for sound options when my son was a baby and we were traveling. And I needed something other than our sound machine, which was at home. But we have used it many times since, even as recently as a month or two ago. And man, he was out like that and it was amazing. But
you would be surprised.
I have also found, I've had a number of clients over the years who like one called Paused. And you have to keep your finger moving the dot very slowly. And if you move too fast, it does a whole thing. But it helps calm and regulate, as well as for folks who may struggle with attention, it can also help maintain attention and sort of build that skill up.
I could see that. Yeah.
Yeah. So I personally find it really annoying because I don't want to slow down that much. But it's really great for other people.
We have one, I didn't include it on that list because it's not as relaxing and things, but I have one, it's called Motivate, and it's got a collection of videos on it, and it's mostly meant, like, it reminds me that I don't work out enough and different things like that. But there are some videos that it's like they have this drone that goes around the world, and you can see like these world different areas, and it's like, you know, kind of giving you different, sometimes it's a motivational speaker, sometimes it's like 2 minutes, sometimes it's, you know, 10 minutes. And I just like it because you can, if you're in some kind of a mood, you can search on it and be like, you know, I need to hear this. And then all of a sudden you hear this motivational speaker that's telling you can do anything you know, put your mind to. And or like maybe I just want to see something that I've never seen before. And so then you've got this drone that's going over the Grand Canyon and stuff, and you're just like, whoa, okay, that's really cool. And you can watch it like right there, anywhere you are. Because that's the other thing, is I think people think you need, you know, half an hour or an hour to do a skill, but like even you said, maybe it's listening to one song, or maybe it's, you know, taking a few deep breathing things for 2 minutes, and that can just help kind of get you refocused again. I think sometimes sometimes that's all you need.
Yeah, fresh air is a big thing in our house. When one of the two of us, be it the small human or me as the big human, need our emotions reset, fresh air is a magical prescription for us. And so whether it's cold, warm, I mean, it doesn't really matter. It is the fresh air and breathing it in. And even if it's a short walk to the end of the street and back, that can help. And I think that's a good reminder for people that, you know, self-care doesn't have to be expensive. It doesn't have to be time consuming. It can literally be walking outside of your front door, or doing something different with your phone and the device that you have attached to you all the time.
Exactly. Very true.
So I want to thank you, Megan, for taking time to present to everyone today. And I will also add, I think one of the first professional meetings that I attended with Megan after I started with the county was you presenting on self-care to a room of crisis providers. And so I can also vouch for the fact that this, not just anxiety, but a lot of the wellness and self-care and coping really is a passion for Megan, because it was one of my first interactions with you in my role now. And I want to thank all the attendees who came and spent some time with us today. Kevin put in the chat box the link to register for more upcoming sessions, as well as the link for the BHCC YouTube channel, which is where we are putting all of our previously recorded sessions after they happen. So this one will be out there as a resource as well. I ask that you give us about a week, but they are usually posted within a day or two. So GoToWebinar has a pretty quick turnaround, and Kevin subsequently also has a pretty quick turnaround on that. But just in the event that technology fails us or time gets in the way, give us about a week. But we hope to see you all soon, and hope you found the information helpful, and that you all have a lovely evening. Have a good night.